and welcome to our special show, Living Long and Healthy with COVID Vaccination. I'm Gargi Rawat. Now, this show seeks to address any concerns, any doubts you may have regarding the COVID vaccination and living in this new normal, because the risk of COVID infections, remember, that continues. Even as restrictions have been eased, cases are on the rise, and vaccination is the only way we can protect ourselves and end this pandemic. We have experts with us to address all your questions and concerns regarding the vaccination. So today on the show, we have with us Dr. Rupam Choudhury, consultant diabetologist at Apollo Clinic, Dispur, Assam. We also have with us Dr. Ravi, a consultant diabetologist at Chennai Diabetes Care, Chennai. Dr. Tapan, director in HOD Cardiology at Fortis Hospital, New Delhi. Thank you so much, doctors, for taking your time out and joining us on the show to answer all these questions. Dr. Rupam Choudhury, I'd like to start with you. And this is a doubt that many people have, and while it sounds perhaps very simple in a sense, if you could clarify it for us, can one get COVID from the COVID vaccination?
Just to answer that, we'll have to first understand what kind of virus vaccines we have against the virus. So there are specifically two types of virus vaccines against the viruses we have. One is messenger RNA type of vaccines, and the other type is viral vector vaccines that is available in India. So this messenger RNA virus vaccines that we have, those are available in US market and in Europe, manufactured by Pfizer and Moderna. And now in India, what we have is we have Covaxin from Bharat Biotech, and we have Covishield manufactured by Serum Institute. Both of these are viral vector vaccines. That means what they do is they modify the virus, the active virus, to a harmless virus, and it cannot cause the disease because it is all totally harmless. And what it does in body is it triggers the immune system to act against the virus. For instance, this Covishield is just a modified harmless form of the common flu virus known as adenovirus. But then it cannot cause common flu virus. And this vaccine resembles to coronavirus, so the body recognizes the vaccine and prepares its immune system to act against the virus and prevents us from getting sicker. My answer would be no, you cannot have COVID infection from these vaccines of COVID.
All right. Thank you so much for explaining that to us. Now, Dr. Ravi, the vaccines currently available in India are Covishield and Covaxin, and are they effective against the different strains of the virus? Because now there's talk of all these variants.
Yeah, absolutely. Actually, both the viruses are known to give a lot of protection against, especially the UK virus and the UK strain, as well as the Brazilian strain. And then that is actually a lot of data is available. Where we are yet to get the data on South African strain. It's some research is going on. Probably will be in a few more days we'll be knowing about that. And then my sincere advice actually see these mutations going to keep happening, and then new strains going to come up. So whatever is available at this point, you better take the vaccine so that we prevent the mutations and new strains to coming, and then don't wait for the perfect vaccine to give protection against all strains. That's not going to happen. So now and then, as a new mutation, new strain is going to come up, so that whatever is available at this point, you better take that so that we reduce the spread, so as well as the mutation and the strains.
Dr. Tapan Ghose, now another very simple question for you, which many people want to know. How does the Covaxin vaccine work?
Thank you for these pertinent questions. This question, although simple, we must understand what am I getting. It utilizes body's own defense mechanism for protection against the disease, and that's what does all the vaccines. What happens is this vaccine contains a viral particle which is killed virus, 6 microgram, along with the immunobooster, aluminum hydroxide gel, which stimulates the immune system further. You can tell it's the immune booster. So when they're injected in the body cells recognize this as a foreign protein and manufacture some antibodies or defense proteins. Now, these antibodies are the protective factors for all the viral diseases. So, next time when after 4 weeks we give the second dose, this immune response is enhanced and the body has the protective level of antibody or the defense mechanism against this virus. When the patient is or the person is exposed to a situation where he can catch the virus, this time the virus will be recognized by the proteins and it will not be allowed to multiplicate or replicate in the body first place. Secondly, even if it multiplies or he gets the disease, the severity of the disease or the COVID-19 will be very much less, and the fatality rate, hospitalization, etc. will be very, very less. And it protects 80% of the individual exposed to the virus. So it's a very effective vaccine. Covaxin is a marvel in terms of rapid protection and giving to the world. And it's a pride for India to give to the world a vaccine in a short time and so protective. I think this is going to change the landscape, and all of us, all the patients or the individuals should take this vaccine, and they shouldn't have any fear for taking this vaccine.
That's right. Everyone should go ahead and get the vaccine if they're eligible. Dr. Choudhury, are there any special precautions to be taken for people with diabetes and kidney disease? Should they take a vaccination on the day that they're getting dialysis? If you could just, these are a lot of doubts that people have.
Yeah, of course. So I advise my patient, because I'm a diabetologist, I see diabetic patients throughout the day. So many patients, they started calling me up after the vaccine is introduced in market, and they were, they had all these doubts. Should I get vaccinated? If my sugars are high, should I wait for my sugars to get under control and then get vaccinated? And again, we have 20 to 30% of our diabetic patients having kidney problems. Now, we all know that diabetes and diabetic kidney disease patients, they are very much vulnerable to all the infections, not only COVID, but all kind of viral and bacterial infections, because their immune system is compromised. That is the reason the first priority patients who should get the vaccines is these kind of patients who has got immunocompromised conditions like diabetes, diabetic kidney disease, somebody with cancers and HIV. So these patients should get vaccinated at the first moment they are able to get the vaccine. So yes, diabetic patients should get vaccinated as soon as possible. And before getting vaccinated, it's always advised to get their sugars under control. They should visit their doctors to get their drugs, oral drugs or insulin doses titrated to get optimal glycemic control, and then go for the vaccine. High sugars are not a contraindication for not getting vaccines, but then, there are chances that if your sugars are very high and you can get some infection at the site of vaccination, you can get some abscess kind of thing or hematoma kind of thing, which can later on become abscess. So these are few things we should keep in mind before getting vaccinated in diabetic patients. And kidney patients, many patients are asking today, I have my dialysis, should I take the vaccine? Again, I would say that there is no contraindication, but then, on the day of dialysis, many patients get heparin along with while they're on dialysis. So there are again more chances of hematoma formation. So it's always better to wait, get dialyzed, and next day you can take the vaccine without any complications.
Dr. G.R. Ravi, are the side effects for people with endocrine disorders different than others?
Not really. Actually, this vaccination has got no direct relationship with diabetic medicines or thyroid medicines. It's not going to directly affect the blood values anyway. But vaccination causing some systemic illness like just mild fever and body pain can increase the sugars a little bit. And then uncontrolled diabetes people, definitely if they can get that a little bit under control, then go ahead with the vaccine that would be advisable. As a thyroid disease, actually the thyroid hormones and vaccination so far, whatever data is available, it's not going to affect the medications in any way. So we don't see, I've seen so many people, like all uncontrolled diabetic patients, elderly people already taken vaccine, and then so far not even single real big complication we have seen so far. Both the vaccines, whatever available in our country, is really safe. And then people should not even think about twice, like go straight away, go and take the vaccine immediately as soon as possible.
Absolutely. Thank you so much for answering that. Well, with that, time for us to slip into a short break. We'll be back and answering all those questions and doubts you have regarding the vaccination. Stay with us. Welcome back. You're watching our special show, Living Long and Healthy with COVID Vaccination, where we're answering any doubts that you have about the vaccines. And we have our panel of doctors with us. Dr. Tapan, Ghose, the next question to you. Are there any special precautions to be taken for people who have lung disease or asthma as they go ahead for that vaccination?
Many patients, they have asthma or lung disease or heart disease also. So they can take the vaccine. There is no contraindication to take the vaccine. So in a patient with a lung disease, if the patient is having active disease, then probably should consult his doctor before taking the vaccine. But, otherwise, pre-existing conditions which are stable, treated, on treatment, then there is no contraindication to take the vaccine.
Doctor, what about their medications on the day, steroid medications, inhalers? If you could just quickly tell us about that.
Steroid inhalers need not be, stopped. They should take it, as their usual thing. Period. I mean, oral steroid also they can take as there's no relationship between stoppage or the immune response. Only thing is that if they're on high dose of systemic steroid, the immune response is going to be a little low, but there is no indication to stop their drugs or modify their dosage or skip the dosage. They should take it.
All right. Dr. Rupam, what about people who have high sugar levels, hyperglycemia on the day of the vaccination? If they measure themselves, should they then go in for the vaccine that day?
Again, as I have mentioned, there is no hard contraindication against taking vaccines when sugars are very high. But then, it's always advisable to get your sugars under control. Consult your doctor before going to vaccinations and get a probably clearance sign from the doctor that his glycemic control is good and he is good to go with the vaccination shot. So if somebody has high sugars like 400s or 500s, there are always chances that he can have some, as I mentioned, the site of injection, he can have later on infections and then it can turn into abscess. So again, control your sugars first and then go for the vaccine. That's what I advise my patients.
All right. And Dr. Ravi, people with diabetes on insulin therapy, what precautions should they take, if any, on vaccination day to prevent hypoglycemia?
Yeah, actually, as I told earlier, there is no direct correlation between insulin and vaccinations and any other diabetic medicine, in fact. Only thing is somebody they should usually, whatever the routine they should follow, don't skip any medicines, and then whatever usual physical activities they used to do, they can go ahead. And then on the day of the testing, on the vaccinations, they have to hydrate themselves very well. It's better to take a lot of water and then avoid taking insulin at least for another week after vaccination. And these are the things they should follow.
Dr. Tapan, Ghose, should people who've had recent heart surgery go ahead and take the vaccination? And is there any sort of special precautions that they need to take if they do go for that vaccine?
So actually, let's take 2-3 situations. One is the patient had angiography and angioplasty, and he had a recent myocardial infarction. So he either had a primary angioplasty or delayed angioplasty. That's one group. Another group of patients who are heart failure patients are on blood thinners. Third group would be post-bypass surgery group. So the first group, who had an angioplasty are on 2 blood thinner medicines, and since they had a recent angioplasty, I always advise them to take the shot after 4 weeks following their angioplasty, because that's the time, by the time endothelialization is almost complete, and then that's the safe period. So they need not stop their antiplatelet agents, they can take it. Although in the initial trial when we started, patients on antiplatelets or the contraindications. But we have gained sufficient experience, and in our practice, we never stop the antiplatelets, and we allow them to have the shot. So 4 to 6 weeks following that, angioplasty. Second group, a heart failure group patient, if they are on blood thinners, anticoagulants, then also we do not advise them to interrupt anticoagulation. They can take the shot because the trauma of the vaccine, which is very, very minute, is controlled, and the hematoma formation, even on drugs, even on dual antiplatelets and anticoagulation, is so trivial. It is never reported by the patients. We have done many patients and we never stop. Third group of patient of bypass surgery, again, 4 to 6 weeks gap from the bypass surgery, because that is the time the healing has taken place. And the patient should take the shot after 4 to 6 weeks of bypass surgery, and they should continue their antiplatelet drug. Final decision is based on the clinical assessment by the treating physician, because antiplatelets, their clinical stability and symptoms, ejection fraction, and also the glycemic control in patients of diabetes and blood pressure control. So we always recommend that patient's clinical condition should be stabilized, and his blood pressure medicine, sugar medicine, and all antiplatelets should be optimized. When everything is fine, that is the time he should take.
All right. And coming back to the medication, Dr. Rupam, should people with thyroid disorders go ahead and take the vaccine?
Yes, of course. I mean, there is no role of, stopping thyroid medication before getting the vaccine. You should continue your thyroid medication. Not only thyroid medications, you will have to continue your antihypertensive, that is the BP medicines that a patient take regularly. And as our cardiologist also mentioned, that we'll have to continue the antiplatelets, patients who had bypass surgeries or angioplasty in those cases, and take your regular medication. Don't skip anything. Even take your insulin shots if you are on insulin that day before breakfast. And then afterwards, with good glycemic control, you can go and have the vaccine.
Right. And Dr. Ravi, finally, any precaution that elderly people need to take who have diabetes?
Yeah, actually, this elderly people are more prone for hypoglycemic events. They shouldn't be skipping. Taking normal diet is mandatory. And then in case somebody's got a very tight control, some people are like, we see sometimes, elderly people, they try to keep the sugars under spot on perfect control. And those people, they should actually can reduce 1 or 2 units insulin if they are taking insulin, or if they are on only oral anti-diabetic drugs. They can take little bit extra food and go, so that they don't get into hypoglycemia. And then they should be adequately taking liquid so that they get dehydration. And then in case, if it is aggravated, in case, for example, there's more pain or more fever, so they should take paracetamol, and if it is very severe, they should consult a physician so that they don't get into severe post-vaccination complications.
All right. And one final question, Dr. Tapan, Ghose, any special advice for pregnant women who want the vaccination? Are they even eligible for vaccination yet?
Actually, pregnancy is a tricky situation. As you know, this is evidence-based medicine, and initial trial, pregnant women were not included. And as a result, we really can't give any recommendation based on the evidence. So at the present moment, it is not indicated, and the pregnant women should decide their own. So medically speaking, we do not have any evidence that it is safe for either for the fetus or the pregnant mother at the present moment. So some countries, they've allowed their expected mothers to take the vaccine, like US. It is an informed decision by the mother, and if mother wishes, she can take the vaccine.
That's very important for pregnant women to watch out for. Though interesting to know that different countries have a different advice on this issue of pregnant women taking the vaccination. Well, that's all the time we have on the show. Thank you so much, doctors, for taking out your time and joining us and answering all those doubts and questions that people may have. But the overriding message that all the doctors have is go ahead and take that vaccine, because this is the only way we're going to fight this pandemic. It's the only way that you can protect yourself. Thanks so much for watching. Goodbye.